Hello everyone, in this video we are going to discuss about some important points in the pneumonia. So what is pneumonia? Pneumonia is an infection of the lungs that causes inflammation in the alveoli, that is the tiny air sacs. These alveoli will be filled with pus or fluid which makes hard to breathe. So gas exchange will be hampered because of this fluid filled alveoli. So coming to the types of pneumonia, it can be divided into lobar pneumonia, which is the most typical form of pneumonia, atypical pneumonia, bronchopneumonia, aspiration pneumonia, hospital acquired pneumonia, ventilator associated pneumonia, and immunocompromised pneumonia. First, lobar pneumonia. It is the most common pneumonia and it occurs in the healthy adults. There will be sudden onset high fever, productive cough, and lobar consolidation will be seen. Most common pathogen is Streptococcus pneumonia, H influenza. So we can see here there is a lobar consolidation at the upper lobe of the right upper lobe of the right lung. So it is a lobar pneumonia. Next is atypical pneumonia. Here it occurs in the young adults and crowdy settings, like infections like Mycoplasma, Legionella, and Chlamydia. Here the clinical clues will be there will be dry cough. Instead of productive cough like in lobar pneumonia, there will be dry cough, low fever, diffuse interstitial infiltrates, and normal WBC. Here we will see diffuse interstitial infiltrates. As we can see in this picture, there are diffuse interstitial infiltrates in both the bilateral lungs. Both the lungs. Next, bronchopneumonia. It occurs in elderly and post-viral hospitalized patients. Here it is insidious in onset, fever with patchy bilateral infiltrates on the chest X-ray. The most common cause is Staph aureus, Klebsiella. So we can see patchy infiltration here. As we can see in this picture, this is a bronchopneumonia. Next is aspiration pneumonia. It occurs whenever the patient is unconscious, like in stroke, alcoholics, in case of seizures and dementia. There will be foul smelling sputum, and right lower lobe is involved if the patient is sitting up, and right upper lobe is involved if the patient is supine or in lying down position. Right is more involved. Right bronchus is more vertical and wider and longer. So right lung is more involved in these cases. So next is hospital acquired pneumonia. It occurs more than after 48 hours after admission. It occurs mostly because of any resistant bugs and new infiltrates and fever. Here the common causes MRSA, methicillin resistant Staphylococcus aureus, Klebsiella, and Pseudomonas. Next is ventilator associated. So after 48 hours after intubation, if there is pneumonia, it is ventilator associated pneumonia. It occurs in ICU settings. There will be purulent secretions which is worsening with oxygenation. Here also the main causes the Pseudomonas and MRSA. Next is immunocompromised. As the name suggests, whenever the patient is having HIV or taking chemotherapy or any transplant, because the patient is using corticosteroids. So in these cases there will be ground glass opacities and dyspnea with atypical signs. So Pseudomonas, Pneumocystis jirovecii, CMV, and the fungus are the most common. So coming to the lobar pneumonia pathophysiology, here it will be in 4 stages. First is congestion, next is red hepatization, grey hepatization, and resolution. Congestion occurs in day 1 to 2. Here what happens is there will be vasodilation. Because there is infection, there will be vasodilatation, so there will be increase in the blood flow, so that the WBC will reach the area and bacteria can enter so here they can engulf it. So there will be first stage is congestion, there is vasodilation and increase in the blood flow. Next is day 3 and 4, there is red hepatization. Red hepatization because it looks like a liver and it is red in color. The lung look like a liver, that is hepatization. Here there will be alveoli filled with RBCs, neutrophils, and the fibrin. Day 5 and 7, here there is grey hepatization. Here RBC will break down and fibrin and WBC will remain. This is grey hepatization, this is red hepatization. Next is after day 8, there will be resolution. That is macrophages will clean the debris and lung returns to the normal stage. So first stage there will be heavy and red lungs. Next stage there will be red lungs, liver-like feature. Next is greyish lungs. Next is healing stage, where the sputum will clear and improved breath sounds we can hear in the resolution stage. So major points we have to remember is, if the patient is having currant jelly sputum, it is mostly cause of Klebsiella. Rust color sputum is seen in Streptococcus pneumoniae. Post-flu pneumonia, most common causes Staphylococcus aureus. If the patient is having hyponatremia with gastrointestinal symptoms with pneumonia, then we have to look for any Legionella infection. So this is the pathophysiology of the lobar pneumonia and most important points and types of pneumonia and the features and the important points.